Okay, so today we're going to discuss about the other nematodes. We'll be discussing about the Trichuris, the Capillaria, the Trichinella, and we'll also hear the related species Hookworm and Strongyloids. So first we have here the Capillaria philippinensis. So from the word itself, from the name itself, so it's philippinensis. So this is a parasite that has been isolated, has been discovered in our country, Philippines. Okay, so other name for your Capillaria philippinensis, we have the pudok worm. Other name for that is your mystery disease, because that time they could not even identify the cause or why the patients will have here some manifestation of that related to this parasite. And therefore, eventually later on, we're able to discover that has been implicated with this Capillaria philippinensis. Okay, we have here some historical milestones related to the prevalence of the infection of your Capillaria philippinensis. So we have here in 1962 has been discovered in Bacara, Ilocos Norte with some incidents of diarrhea related to this parasitism. It was then 1967 where it became prevalent between 20 to 49 years old, and that was then prevalent in the areas like Podok, West Agundin, Ilocos Norte. That's what's being called here Podok worm, and also in areas of La Union and Pangasinan. In 1972, it will have here identified as this parasite could transmit infection by infecting with the ova of this parasite, infecting here the. Okay, so we have here your. Okay, so rats, monkeys, and we have also here the fishes. Okay, the transmission of the ova to the fishes as an intermediate host, and we have also rats and even the monkeys. We have here the morphology. So the adult worm measure here 2 to 4 millimeters, so very small, making that one as tiny thread-like worm, very delicate worm. Okay, for the male, again, this would have here the same characteristic as being smaller compared to the female, and it would have here the posterior end tail. And for the male, the posterior end tail, which is curved, and would have here another, aside from the curved posterior end tail, would have an extension. You call this one as your chitinized spicules. Again, the chitinized spicule try to extend beyond its posterior end tail. Okay, for the female, we have here two. Okay, female adult worm. Okay, we have here the typical, and we have also here the atypical. Okay, the typical female adult worm is the one that's trying to lay the egg or the ova, and it is identified here having a single row of uterus containing 8 to 10 eggs in that row, in that entire uterus. For the typical female, on the other hand, so this is the one that try to lay the larva, and this is responsible here for the autoinfection. Okay, so this is actually the typical female, the one considered here as a first generation female adult worm, whereas your typical configurator here as the second generation female adult worm. The typical female adult worm, the ones try to lay larva, and that one would have here the ova containing here 2 to 3 rows. In each of this one, approximately there are 40 to 45 eggs on that. Okay, for their egg, we describe this one as also classifying that one as typical and atypical. The typical egg is the characteristic peanut shape that would have your striations and would have also the bipolar plug, only that the bipolar plug here is flattened. As what we have discussed in your trichures. Trichures will also have the bipolar plug, only that one is protruded. This one is a flattened bipolar plug. A typical of, on the other hand, characterized by peanut shape, but that one do not have striations, and the one that's possible here for the autoinfection. Okay, we have here the difference the egg of the Trichuris trichura and your Capillaria philippinensis. The first one, your Capillaria philippinensis egg is much smaller compared to your Trichuris trichura. And second one, we have here your Capillaria philippinensis would have the presence of your striations, whereas your Trichuris do not have striations. And another one, in terms of their bipolar plug, Again, your Capillaria philippinensis is flattened compared with the protruded bipolar plug in your trichuris trichura. As for the side, this one is much more straight, more than convex as with your trichuris trichura. Okay, then we have here the life cycle of your Capillaria philippinensis. So you get infected by ingestion of poorly cooked intermediate hosts, which are your glass fish or transparent fish. This includes your ipon, bagot, or your bagoong. So basically, that one contains here the L3 or the third stage larva, which is the infective stage. Then you try to ingest that one. Your L3 will go to your will pass through your MES mouth, esophagus, your stomach, then go to your small intestine, where it tried to develop here to become adult worm. So once it try to develop here to the adult worm, you have here your adult male and a female worm. They try to copulate. And then there are two types of your adult female worms. So the one which try to lay the larva, which is your first generation. The one which try to lay the larva will be the one responsible here for the retroinfection or the autoinfection. So when speak about the retroinfection or the autoinfection, so the parasite reinfect the patient even without leaving the body of the host. Since the first generation the first generation adult female lays the larva, and therefore the larva will stay inside your body, and then another cycle become adult again. So with another cycle of your infection, it become the reinfection. On the other hand, the second generation adult female here will going to lay the egg and the one we're going to shed in the feces of the infected patient. Once the egg here try to gain entry to the bodies of water, it try to hatch, liberating the L1 or the first stage larva. Then that L1 will be ingested by your intermediate host. Inside the body of the intermediate host, the L1 will develop to your L2 and eventually developing here to the L3, which is your third stage larva, becoming the infective stage. Okay, then we have here the pathology. This is pathology related to your Capillaria philippinensis infection. The first one, we have here the malabsorption syndrome. Malabsorption syndrome because the parasite try to damage the microvilli of your small intestine, which is the site of our absorption. So when all your microvilli has been flattened already, it's been damaged already, could not reabsorb, and therefore the patient will have here the malabsorption syndrome. Then, since the adult worm is in the intestinal tract, in the small intestine, would have your abdominal pain related to that. The patient also have, we're going to experience here the borborygmus or the gurgling sound of the stomach due to massive peristalsis and this is actually similar to your hunger pains, kumukulo ang tiyan. And the patient will have here weight loss, loss of the appetite, and of course the diarrhea. And plus, the patient would have here electrolyte imbalance because the massive diarrhea. Expect to have here decreased electrolyte levels, sodium, potassium, decreased cholesterol, even the proteins. For the diagnosis, we could diagnose the patient here by finding the presence of the ova, typical ova na peanut shape, with striations with the flattened bipolar plug in the stool through your DFS or even your concentration technique. For the treatment, still mebendazole is effective for this. Okay, next one, we have here your Trichinella spiralis, also called here as your trichina worm. So, Trichinella spiralis is a zoonotic, most likely try to infect here your pig or even other animals. And human may have here serve as your accidental host. Okay, so we consider this one smallest zoonotic intestinal parasite and even your tissue nematodes because the larva could eventually try to encyst in the striated muscles. Okay, for the morphology, so we describe adult here as slender anterior end with small orbicular, non-papillated mouth, and it's ventrally curved with two lobular caudal appendages also we have a long narrow digestive tract. For the male, measure 1.5 by 0.004 millimeter long, and ang kanyang posterior end tail would have the presence of your pair of your conical papillae or you call posterior claspers. They use this claspers or conical papillae for their attachment to the intestinal mucosa. For the female, this one is 3.5 by 0.006 millimeter. This is larviparous. It do not lay egg, but rather it try to lay the larva. And we have here the single ovary. And again, it try to lay approximately 1,500 larvae per day. Again, it does not lay egg. Both of your male and a female adult worm in their posterior and tail would have the presence of the prostocible stylus. In the anterior part, in their mouth part, they have the specialized cells here found in their esophagus. The esophageal cell, they call that one as your stegosomes or stegocytes. Again, your stegocyte could also be found not only in the capillaria, but as well in your trichuris or even in your Capillaria philippinensis. Okay, for the life cycle, again, you get infected by your Trichinella spiralis by ingestion of poorly cooked meat because the meat here contains the encysted larva in the muscles. And once you try to eat that one, so it go to your mouth, esophagus, and your stomach where try to exist, liberating here the larva. Then the larva migrate to your small intestine where try to develop to become adult worm and try to develop here into your male and female adult worm, which eventually try to copulate. And the time will come, the female adult worm or the grubby female will going to lay the larva. Okay, and the larva would try to bore itself in or try to insist itself in the serrated muscles of her body. And for the human, once it try to infect the human, it become a dead-end infection. So once your larva try to ancestor muscles try to form here a lemon-shaped capsule and become a dead-end infection or dead alley. When you speak about the blind infection or dead-end alley, the infection will not no longer able to be transmitted to another patient, another person through your person to person. Because of course we are not eating human because we are not practicing cannibalism. Okay, then we have also here the disease pathology related to your Trichinella spiralis infection. So we try to cause your tissue inflammation, calcification, granuloma formation, and the patient also have experience here diarrhea because of the intestinal invasion of your adult worm. Remember, the adult worm is in the duodenum of your small intestine, and therefore it would have a disease pathology manifestation. Then we have also here the muscle pain related to the invasion or the infestation of your larva. Okay, to diagnose the infection, you could have here your Bachman intradermal skin test that's being done here after 3 weeks. The patient will give positive result for that. Then we have also the NAS concentration technique, which is your blood concentration technique to recover the larva. Procedure for that, you have here 1 ml of the blood of the patient. We're expecting that blood contains the larva. Then you add 9 ml of your 2% formaldehyde and observe here the presence or try to recover here the presence of the larva. Then for our muscle enzymes, like your creatine phosphate, we have also here your creatine phosphokinase, aldolase, and your lactate dehydrogenase, which are muscle enzymes, will also be increased because they have here the muscle injury related to the larval encystation. You can also have here the xenodiagnosis or laboratory animal inoculation, where you try to inoculate like a specimen coming from the patient, inoculated one in your laboratory animals to check here if the patient really has an infection. So after a week, you try to examine the muscles of the laboratory animal for possible larva. Okay, then we have here the number of or the parasite most likely try to be present in the following muscles. So your heart would have your high concentration of the larva insisted on that. Also diaphragm, tongue, and we have also here your delta liver arms. For the diagnosis, again, DFS, muscle biopsy, and could also have here the treatment still mebendazole, albendazole, and we have also here the ivermectin. Okay, the next one, we have here the hookworm. So, we'll be discussing about here the two human hookworms. So, we have here the Necator americanus and your Ancylostoma duodenale. And we have also here the animal hookworm, your Ancylostoma brasiliense and Ancylostoma caninum. We try to cause here the cutaneous larva migrans or your creeping eruptions. Okay, for their mouth, okay, for Necator americanus made up of your pair of your semilunar cutting plates. This is the ventral side, this is the dorsal side. So in the dorsal side, you have here one teeth or one tooth, and we have here the ventral side, the absence of the teeth or tooth. For your ancylostoma brasiliensis, that is characterized by pair of your ventrals, again ventral na side, pair of the pair of your ventral teeth, and we have here your pair of your inner inconspicuous teeth. For your ancylostoma caninum, so this would have here three pairs of your ventral teeth. And for ancylostoma duodenale, would have here two pairs of your ventral teeth in absence of the dorsal tooth. Okay, then we have here the morphology of your hookworm. So we're talking about here the your human hookworm, Necator americanus, and your ancylostoma duodenale. So adult male measures 7 to 11 millimeters, and then the posterior end tail with the presence of the copulatory bursa. Each of that contains this specific na copulatory spicules. For the female, measure 9 to 13 millimeters, and that one would have a straight posterior end tail. For the ova, it's 58 by 76, 58 to 76 by 36 to 40 micrometer, and containing here the immature segmented cell stage. So we'll be discussing later on that each of your Necator americanus and Ancylostoma duodenale would have here the different number of cell stage or below. But in terms of their ova, you could not distinguish them under the microscope. So when we are identifying your hookworm under the microscope, we do not speciate that one as differentiating or reporting it as Necator americanus or Ancylostoma duodenale. But rather, once we try to identify the presence of a hookworm egg, we report that one as hookworm, not reporting that one as Necator americanus or even specific with your Ancylostoma duodenale because you could not differentiate them under the microscope with their egg morphology. Okay, for the larva, we have here two. We have here the rhabditiform larva, which is your open mouth, it's the feeding stage. And the filariform larva, on the other hand, is the closed mouth, and the one which is the infective stage. You get infected this one by either skin penetration or by ingestion of your filariform larva. Okay, then we have here the life cycle. Again, you get infected by filariform larva either by skin penetration or ingestion, but most likely skin penetration. And then your filariform larva try to go to your skin, then eventually breaks down to your vessel wall, blood vessel. Once it try to enter your blood vessels, it try to circulate your bloodstream, where it could go to your heart-lung migration, pataas, and then swallowed back here to your esophagus, down back to your gastrointestinal tract, your stomach, small intestine, where eventually they try to develop to become adult worm. The small intestine serve as their final habitat for their adult males, and for their adult worm, where they try to develop to become your adult male and adult female worms. Then they try to copulate, and then the female worm, we're going to lay the egg. The egg will be shed on the feces, unembryonated. And then it try to embryonate in the soil. And once in the soil, again, the soil is needed here for the embryonation, making this one as your STH or soil transmitted helminths. Then once it's tried to embryonate, it will hatch, liberating the first larval stage or aptitiform larva. Then finally, it will develop here to become filariform larva, which is your infective stage. Then you get infected by skin penetration of your filariform larva, or even by ingestion of the soil containing the filariform larva.